So thank you for having me. My name is John Glowacky, and again, my partner in crime here is Larry Berman. I'm a staff member for Arlington County, and we both work for the Virginia Insurance Counseling and Assistance Program. Larry is a volunteer, so if you like what you hear and you want to volunteer, we'd love to have you. So to explain what the program is, so Virginia Insurance Counseling and Assistance Program, or VICAP, which is sort of easier to say. It's actually a federal program. So the way this program works, it's part of what they call the SHIP, like a boat ship network. So this program is actually all over the country. The reason it's called VICAP in Virginia is the V is for Virginia, but there's counselors and programs like this throughout the country. It's called part of the SHIP network. So if you have a friend or family member that you think would benefit from a one-to-one counseling session or an educational session like today, you could just go to Google or whatnot and look up SHIP network, and then it'll bump you to the state in which you can find your counselor. So it's a pretty good program. We are federally funded. Even though I do work for the county, the money is sort of pushed down from the CMS, which is the folks that run Medicare. So a very important part of the process for all of us, Larry included, volunteers, anyone that you meet on the VICAP program has to go through a federal certification process where we answer like 200 questions a year about Social Security, and we have to score an 80% or higher. So that's a federal mandate. So we are certified by Medicare. Where are we? So we're located at the Department of Human Services for Arlington County, and that's at 2100 Washington Boulevard. We're on the 4th floor. If you picked up that skinny brochure, this one, it has an 800 number, so if you need to get in touch with us, you could either call us at this phone number or stop off at the local DHS offices to visit us. So we do lots of things. We do counseling sessions, one-on-one, we do presentations. If you feel like you're not getting your questions answered, or you feel like you need a one-to-one, you can give us a call at the 800 number and get an appointment with us, and we do see people. We typically book people for an hour, and it's free, so it's kind of a good program. Okay. So what do we really do best? Well, we really counsel people on Medicare. Even though there's a lot of healthcare choices out there right now, we pretty much focus on the Medicare program. So there's lots of different parts to Medicare. There's Medicare Part A, B, and D, MEDIGAP. Anything really having to do with Medicare and anything around it, we would be able to counsel you with. We also can help you resolve any issues you have with the Medicare program. Along the way, maybe a billing dispute or maybe an eligibility issue or whatnot. We do have some connectivity to Social Security, not a lot, but we do have some. We do have connectivity to also a Medicare regional contacts. So Medicare is also sort of run at a federal level, but then they have regional offices, and then our regional office is in Philadelphia, so we have connectivity with them. So it's a nice way to get in touch with Medicare. Who we serve, anyone that's basically Medicare eligible or due to be Medicare eligible. So anything about Medicare. Again, we serve Arlington County. Believe it or not, this program also touches the city of Alexandria. It's the way we're funded, so if you know anyone in Alexandria, give us a call. So what are we going to learn today? What are we going to talk about? We're going to talk about Medicare. We're going to talk about Medicare in 2015. What's different, what's the same, that kind of thing. We'll talk about all the components of Medicare, A, B, C, and D, and of course what's new. So what is Medicare? So it is for basically a health insurance program. It is federal. It is a federally funded program for folks 65 years or older. Typically, I shouldn't say typically, but you would have to pay at least 10 years or 40 quarters of federal income tax, or FICA. So even though we see some clients that are 65 or greater, but they have not paid their 40 quarters over 10 years, and unfortunately they would not be eligible for Medicare. So as long as you paid your at least 10 years worth of federal income tax and you're 65 or older, you would be eligible for the Medicare program. There are other ways into the program, not age-related, and that's basically folks with disabilities, so you can be below the age of 65. And if you've claimed Social Security Disability or SSDI, there's a 2-year waiting period, and then, or 24 months, and then you would have your Medicare kick in. Also, folks at any age that are experiencing end-stage renal disease or kidney failure or going through kidney dialysis, they're automatically eligible for the Medicare program. So who runs it? It is run by the CMS, or the Centers of Medicare and Medicaid Services. They are centrally located in Baltimore. Again, our regional office is in Philadelphia. So there are fundamentally 4 major components to Medicare. And for those of you that got your Medicare card and whatnot, you'll probably see A and B on there. That's sort of the most common, so to speak. But Medicare Part A is your hospital inpatient. So that means anything that happens while you're inpatient, you're considered sort of administered in the hospital. If you're going in for an emergency room situation and turning back around, and not staying overnight and not being considered admitted, that would generally be a Medicare Part B. So Medicare Part B is everything outpatient. That's your doctor's visits, your lab, your x-rays, all that good stuff. Medicare Part C is another component, and that's Medicare Managed Care. So if you stay within A and B, what they call original Medicare, A and B, you are doing your own thing. You know, you see your own doctors that take Medicare and you're just going about your business. If you want to step outside of original Medicare and into a Medicare Part C program, that is typically run by like an HMO or a PPO environment. So it's what you think it is. It's managed care. So it may represent lower cost for you because there's some efficiencies, but it is a managed care environment where you're getting all your care through, a company. In this area, there are basically 3 companies that are Part C programs. There's Aetna, Humana, and Kaiser. So those are the 3 big players in this part of the country. And it is regional. And then Part D, Medicare, that's easy to remember, it's D, drugs, so that's the drug benefit. And that came along in 2006, if memory serves. Prior to 2006, there was no prescription drug benefit through the Medicare program, believe it or not. So you just had to do your own thing, pay your own bills. But then 2006 came along, and now we have the Part D program, which we'll talk about. Okay. So again, Medicare runs, it's a federally run program, provides you A and B. You could see any doctors if you stay within original Medicare. You could see the doctors that you choose. What do you pay? So if you paid your 40 quarters and your 10 years, your Medicare Part A, your inpatient, is premium free. So there's no cost for that to you. You just get it. But Medicare Part B does represent a premium payment. So out front, we had like a blue, it says Medicare Training Program on it, and has some of the rates on there. It's right over there. So Medicare Part B, the base rate for Part B is $104.90. So that's typically what people pay. It does income adjust. So if you're making $85,000 a year or greater, you're paying another like $20 on top of that 104, and it continues to go up with income. But pick up that, I think Alexandria's going to get it. Yep, perfect. You'll get a monthly summary notice, or actually it's quarterly, about all your activity. You could sign up online to see everything that, the billing activity that has come across. Yep, that's exactly it. Thank you. And then you also have the chance to join Medicare Part D, which also represents premiums. So here's enrollment for you. So it's automatic when you turn 65. It is automatic if you're collecting Social Security. In other words, Social Security runs the whole show here. So if you're signed up for your Social Security, your 65th birthday is coming up, the big computer, within Social Security says, well, I know this person's turning 65. And then they send you a card that looks like that. It's paper. It's like a heavier weight paper. But if you don't collect Social Security, which some people don't, they choose to, push it off for as long as they can, it's likely that Medicare is not going to know you exist. So you can collect, not collect Social Security and get your Medicare benefit. That's very common. So a lot of what we do, a lot of phone calls we get are people saying, well, my 65th birthday was last month and I didn't do anything. So our suggestion is call Social Security. Just tell them, raise your hand. I want my Medicare. Because, sometimes Social Security will catch it, and sometimes they won't. So let's put it this way, if a month before your 65th birthday is there, and you're not taking Social Security and you haven't heard a word from Medicare, I will pretty much guarantee that they don't know you exist. So just pick up the phone, call Medicare and say, or go online and say, I want my benefit. Okay. So the initial enrollment, what that means is basically it's a 7-month window within your 65th birthday. So it starts with the 3 months prior to your birth month, and then 3 months after. So your start date of Medicare is always the first day of the month of your 65th birthday. It's not your birthday. So if your birthday is on June 15th or whatever, your Medicare start date is going to be June 1st. So, okay. Your Medicare card, again, looks like that. I will tell you that, some people don't even know it's what it is because you're probably getting a lot of stuff in the mail. You're going to be the darlings of every, AARP, not that they're all great companies, but you're probably getting stuff in the mail like crazy, and sometimes it gets shuffled and gets thrown out. So just keep an eye out for it. It's a very unassuming document. It's an 8.5 by 11 piece of paper. You pop out it's like cardboard. And then if you want, which we suggest is get it laminated or something, because it is paper. So it could laundry or whatnot and get all messed up. So you don't want that. Okay. So again, your initial enrollment period is that 7-month period. So it's again it's the 3 months prior to your birth month, and then 3 months after. So that's the 7-month window that you have to join Medicare when you're turning 65. If you miss that window, you have to wait for the beginning of the next year, and your eligibility doesn't start till July of that year. So it's very important to make sure that you respond if you want it, because it's kind of hard to get back in. You got to wait. Okay, so I got ahead of myself here, but if you miss your initial enrollment period, you have to wait for the general enrollment period, which is, we're in it now. So it's January 1st through the end of March, and it won't be effective till July, so that could be dangerous. You could go without a period of time without coverage. And here's the thing, is that there's a penalty for waiting, because the reasoning behind the penalty is to make sure you're not just using your health insurance when you need it. Well, I'm healthy now, so I'm not going to pay for it, but I'll wait till I make my premium payment until I get sick or something like that. So that's not the way insurance works. You're insuring your risk. So they try to encourage you to enroll on time. So your penalty is another 10% on top of that $104.90 that I talked about for every 1 year or 12-month period you went without. So just know that you'll be, dinged, so to speak, and be charged that. You have a couple different ways of paying your Medicare Part B premium. You can have it come out of your Social Security check if you're collecting Social Security. It's very common. Or you could pay them like you would normally pay any other bill, credit card or whatnot. So the question is, what happens if you are working, you're happily working, you don't need Medicare, you have insurance through your employer. So in that situation, the penalty would be waived. So after your group health insurance ends for any reason, so you can either retire or whatever, you would have an 8-month window to sort of jump into Medicare with penalty-free. So the thinking there, quite frankly, makes sense. It's just basically saying, well, if you're happy working and you're happy with your group health insurance, then great. Then Medicare, we're not going to come to us. You could just keep cruising along. So you'd have an 8-month window. You may get stuff from your HR department that is kind of pushing you in that direction, but you don't have to. Yes?
What happens if you're retired on a group plan in retirement, and private insurer that you're under a group plan have a problem?
So the question is, what happens if you're retired but still have the benefit, the holdover retiree benefit, but you're not working, right? So that's a very important point. So the way the penalty works, the rules around the penalty, is if you're covered by a group insurance plan and you're working, you will not be given the penalty. If you're covered by a group insurance plan and not working, retiree, and you want back into Medicare at a certain later date, you will in fact get the penalty. Yes?
Well, I understand.
So again, we just kind of got ahead of ourselves, but that's fine. The employer group coverage, you may, the soft language, so you may want to delay enrollment. That's a conversation you kind of need to have with your HR department and kind of do your budgeting for it to see. I mean, some people feel they have really great coverage through their employer, and it's not costing them a lot of money, so they want to stick with that. So it's all kind of up to you to decide. Once, to your point, once your coverage ends for whatever reason, so you could, leave or retire, or maybe your employment ends, another way, you'll have an 8-month period to jump in without penalty, so that's good. MEDIGAP we'll talk about in a bit, so that's a Medicare supplemental policy that is sold on the private market, so they're not run by Medicare, they're run by the companies you would imagine, Humana and AARP and all those folks. So they're private plans that you can buy on top of your Medicare. And what's interesting about that is that for your MEDIGAP plan, so some people will jump in the Medicare program, they don't have a way of supplementing the Medicare program. Medicare Part B reimbursement is 80%. So that means when you go to the doctor's office, if the bill is $100, you're going to get a bill for $20 because Medicare is only going to pay $80. Medigap plans or Medicare supplement plans are plans outside private insurers that you can buy to supplement that and possibly pick up that extra fees or the addition of the 20% that are out there, the co-insurances that are out there. So Medicare Part A, again, pays for anything inpatient, but it goes beyond that. So it's not just necessarily hospital stays, even though that's the most common. It also would pay for a skilled nursing situation. So typically, if you think about this as a sort of progression, so let's say you have to unfortunately go into the hospital, you stay 10 days, you're being discharged, kind of not really ready to go home, you kind of need some help, but you're not sick enough to stay in the hospital. So you may then go to a skilled nursing facility. So that's a Medicare Part A benefit also. So that's, and again, what's important about Medicare Part A is that it's 100% reimbursement. So there is a deductible around $1,100, or maybe it's like $1,200 now. But after that, it's 100% reimbursement. So if you have to go from an inpatient to a skilled nursing facility, again, 100% reimbursement. Again, you may not feel too comfortable about going home on your own, so you want to get some home health services, so there would be a benefit that would follow that. The thing to remember about the Medicare Part A benefit is that it always follows a diagnosis. So people see this slide and say, oh, home health care services, they're going to come in and they're going to do laundry and everything. Unfortunately, that's not the way it works. It usually is a very diagnosis-driven thing. So they're going to come in, they're going to, help you with your leg or whatever your original diagnosis is, and then physical therapy is very common, speech therapy, occupational therapy, all that kind of stuff. So that's the focus of it. And then end-of-life stuff, so hospice care, it's all considered a Medicare Part A benefit, okay? Important point. So the question is, the hospital inpatient benefit, what is considered inpatient and what's considered outpatient? So to your point, you would have to be in the hospital 3 consecutive days. The 3 days broken up with the day off in between would not count. So it is true. So to consider a Medicare Part A benefit, it has to be 3 consecutive days. So we talked about FICA. As long as you paid your 10 years, you're eligible. Here is some of the numbers for you. It's on that blue sheet that Alexandra was handing out also. But for your inpatient stay, I said it's $1,260 is your deductible. If you do have a Medicare supplemental plan, it'll likely be covered. So, consider that. If you're going beyond 60, so days 61 through 90, your copay or your fee would be $315 per day. And the reason that it's sort of, as you could see, as the longer you stay in the hospital, the higher your costs go up, again, assuming that you don't have a Medicare supplemental, is Medicare saying, well, why are you in the hospital for 60 days? I mean, is there some other issue? Is there a good reason behind it? If, they're trying to sort of encourage the provider to say, well, then we've got to make a decision of some kind, either get you a skilled nursing or get them home or whatnot. So you could see your costs go up there. Anything past 150 days, you're basically paying for all the costs. Some people, have valid reasons for being in the hospital for a very long period of time. There's always an appeal process through Medicare. There's actually 5 layers of appeal. So some people get around this by appealing and say, well, I want to be considered readmitted or whatnot, and they don't get this penalty. Skilled nursing facility, again, to your point about you have to be considered in hospital for 3 consecutive days. You must be in a certified skilled nursing facility to get reimbursed by Medicare, no big surprise there. And you have to be being treated for a condition, specific condition. So the skilled nursing benefit, if you're from days 1 through 20, you have 0 cost sharing. So that's kind of cool. Days 21 through 100, you are $157.50 per day, and then after day 100, you're sharing all costs. Again, the same thinking is that there's got to be some progression of care, and you may have to go back in the hospital or whatnot, but there's got to be a reason behind it. Okay, so home health care, you must be considered homebound. I will tell you the big caveat there is homebound means you don't drive, and that doesn't mean you don't drive forever. It just means for this period of time, you're not driving. So as you go through this process with Medicare, and if you do get to this point, that's a big thing that comes up a lot. And then what they consider homebound really is driving or not driving. And it doesn't have to be permanently not driving, just for the time being, I'm not driving. You must meet a skilled nursing care and a part-time or intermittent basis. In other words, it's not like a full-time person, living with you. And it must be through an approved agency. So paying for home health care fully covered by Medicare. If you're an original Medicare A and B, we talked about that, you do not really pay for anything with the home health care benefit as long as it's within those days that we talked about. Hospice care, so this is dedicated to what they consider the terminally ill or end-of-life care. So you have to be considered expecting to live 6 months or less. You could actually extend that because some people are expected to live 6 months and they go further and they just recertify. But it is a Medicare Part A benefit. Okay, so Medicare Part B, this is outpatient. Again, it's the big benefit there is a doctor's visit, so that's an 80% reimbursement. Any other outpatient services or supplies would also be considered a Medicare Part B benefit. Durable medical equipment, so if you needed oxygen or a wheelchair or a bed, it's all Medicare Part B benefit. Medicare Part B benefit also is this is, I shouldn't say the latest thing, it's probably 2 or 3 years old now, but preventative services are a big drive right now within the Medicare program. So even though Medicare Part B is 80% reimbursement, anything that's considered preventative, and we had some handouts about that, if you didn't get it on the way out, it's actually reimbursed at 100%. So it's a little confusing because you think Medicare 80%, Medicare Part B, 80% reimbursement. Anything that's considered preventative, so mammogram, colonoscopy, there's a huge list. The reason I bring this up is that you have to be very clear when you're at the doctor's office. You have to be your own advocate, and we all know that. But because if the doctor's office doesn't bill it right, and they bill it as a regular office visit, and it was preventative, Medicare is going to think it's an 80% reimbursement situation and pay it at 80%. So we've seen this a lot in our office where people were like, clearly went for preventative service, or I went for smoking cessation counseling, again preventative, and I got stuck with the bill. And it all kind of went back to the doctor's office because they didn't code it correctly when they're billing it to Medicare as preventative. So just keep that in mind. Just be very clear, front desk or whoever, just say, I want to make sure this is being billed correctly. So the question is, where's this magical list of preventative services? Medicare.gov website has a full list of them. So you can certainly call us, we encourage that, or you could go to the website and look at all of them. I mean, honestly, what I see with a lot of very savvy clients, they get that list and print it out, and they actually bring it to the doctor's office. And they just, well, it's like, it's not some mysterious thing that we don't know about. Well, here it is. I mean, so this is what I want. It's very clear. So it is possible within 1 year you would have a wellness visit and a new to Medicare visit. So what's not covered by Medicare? Anything that's considered long-term care. So that is more of the, anything when you think custodial, you know, someone laundry and cleaning and that kind of thing. It's not a Medicare benefit. Anything pretty much routine dental, the dental benefit, there is a dental benefit with Medicare, but it's very diagnosis driven. So if you have an injury or some kind of particular thing, TMJ, you know, the teeth thing, grinding your teeth at night, that will likely be covered. But other than that, it's really not. Anything cosmetic, any acupuncture, hearing aids, that's a very big issue. It's very costly, but the Medicare does not cover anything to do with a hearing aid. So even if you paid for it yourself and we're going in for a fitting, like more of a doctor's visit, they're not going to pay for it. So again, paying for your Part B for 2000, you know, the 104.90 that I talked about is the same in 2014 as well as 15, which is good. There is a deductible for Medicare Part B, and that's $147. That's also the same, 2014-15. Look to that blue sheet to see where you fall on if there's any increase due to income. So the bottom button here is important to talk about, because if you're, you know, living on Social Security and you're sort of lower income, there are, you know, 104 may be very, very expensive for you. So there are actually programs through our office you can get access to through Medicaid, which is the state of Virginia, that may actually help you pay the 104.90. You know, we have clients that are, you know, 104 is like a third, or, you know, it's a significant part of their income. So the idea is that come to us and we'll get you. Again, you can have it deducted if you're a federal retiree or you're a railroad retiree. You could have it deducted that way also. If it's not deducted, again, we were talking about you get billed every 3 months. Some people, you know, put it through a credit card and get points off of it. So, you know, the travel points we all like, you know, well, they do. But you can have it EBT, I think it's code, whatever, direct right out of your bank, whatever is good for you. Okay? So the late enrollment we talked about is the 10% per every 12-month period you went without Part B when you should have had it. If you sign up during the special enrollment period, usually there's, so that would be like if you're ending employment, you would have a special enrollment period. So, MEDIGAP, we talked about briefly, but it's important for us to go back to it. This is a sort of a private insurance, you know, purchasing opportunity, if you will, for people that don't have any other way to supplement their Medicare. Some people have it through, you know, supplemental through their employer or their ex-employer. Some people don't. So this is a way for you to go out on the private market and to find one. They are sold by private companies. It supplements Medicare, original Medicare only. You cannot have a Medicare supplement plan and a Medicare Part C plan. By law, they cannot sell you one. So if they know that you're in Kaiser, for example, and you get someone on the phone or whatever that's going to try to sell you original Medicare, that's to hang up the phone or do what you got to do, but that's not legal. The thing I will tell you about the MEDIGAP or Medicare supplemental programs, the most important thing, is you have a 6-month window from your Medicare eligibility to get into one of these plans with what they call without medical underwriting. Okay? So this is called a guaranteed issue period. So within the first 6 months of your Medicare eligibility, you can pick up the phone and you say, well, I've made my choice, I'm going to go with this company. And they have to take your application and give you a rate on the phone. And of course, they know your gender and they know your age and they know where you live, but that's it. Those 3 components, they have to base their rate on that. In other words, they cannot by law ask you anything about your medical history within the first 6 months of your Medicare eligibility. So they cannot ask you about smoking, they cannot ask you about weight or hospitalizations or any of that good stuff. Because as we all know, when insurance companies start asking for all these risk factors, your rate's probably going to go up. So it's very, very important to remember that as long as it's an important opportunity within that first 6 months to sort of do your shopping then and try to lock it down if you think you're going to buy one. If you do fall out, I'll get to you in a second, if you do fall out of the 6-month window, you can get into a Medicare supplemental plan at any point, but they will medically underwrite you. And that usually means a higher rate. You don't have to do it. All I'm telling you is that if you do it within 6 months, you're guaranteed, you're leveraging your guaranteed issue period, which means you could get into Medicare supplement 3 years into the Medicare program, and that's fine, but they're going to say, well, I want to know where you're in the hospital, I want to know this, I want to know that, and then your rate goes up. Yes? I'm sorry, the question is, how do they know your income to base your premium payment on? And the answer is income tax. So IRS does talk to Social Security. They go for tax records from 2 years ago, and they impose that rate for 1 year. And then you adjust, right. So I will tell you that some people have problems with this in the sense that often if you retire, you may get a big payout. So that 1 year of income would be pretty high, and you may get imposed, not really a penalty, but the income-related additional charge on your Medicare Part B. But then maybe the next year it goes down because it was only a one-time payment. And it's not uncommon for you guys to be having to chase Medicare down and saying, stop imposing this additional fee, but I only made that money 1 year.
But they impose it for your first year.
They look at your tax records from 2 years ago, and they impose it for 1 year. Yeah. Yes?
Your 6 months for the MEDIGAP eligibility starts from your date of Medicare eligibility.
Exactly.
Whether or not you have Part B.
Well, it's really about your Part B. So it's your Medicare A and B eligibility.
Okay.
Yeah. Okay. All right. So MEDIGAP, again, it's a chance for you. They are standardized, these plans. We do pretty good counseling. I think, we're counselors, so we don't have any particular commercial interests. But in our office, we do have lists of all the Bureau of Insurance through Virginia actually puts out a very nice list of all the insurance companies that offer these plans. So it takes all the marketing out of it and all the stuff out of it, and it's just a list, which is good. So if you're in the market I encourage you to call us if you're in the market for one of these Medigap plans. Larry may get the example for us, but we could send you this. It's called a buying guide for supplemental, and again, it's a very non-commercial looking document, because it's just a table basically, and it's very good, because it just lists all the rates and it takes all the stuff out of it. So, okay. So Medicare Part C. This is Medicare HMO, PPO, usually environment, managed care environment. It is an option for you. You are still part of the Medicare program. Just because you're with one of these companies that I mentioned, Aetna, Humana, Kaiser, does not mean you're stepping out of the Medicare program. It just means you're getting it administered through them. That's all it really means. What else can I tell you about that? So they're basically, the way these plans work, they're regional. So when I mentioned those 3 companies, those are the 3 that service this part of the country. If you were to go to Florida or Arizona or wherever you want to move, you'll likely be given different choices, because it depends on what's within their service network. I will tell you, as a counselor for 5 years now, what people like about these Medicare Part C plans is that they usually represent lower costs. So your co-pays may be a lot less. It may be $10 per doctor's visit, instead of 20% every time you go. But what they don't like about them is it's a managed care environment. So, it's what you think it is. You get your care through Kaiser, let's say. You pretty much have to go through them. Some people like that environment. They feel like it's easier. They could just show up at Kaiser and get everything done, just as an example. But just think about those things in terms of your use and personality, whether that's a fit or not. Yes?
So what happens if you sign up, say, in Virginia, but then 5 years later you do move to Arizona?
Yeah, you would have a 3-month period. Anytime if you move to a different area, you have 3 months to change to a different plan with no penalty. So, yeah. Okay, so again, they act like a lot like an HMO or a PPO, but just look at them. So those are the three in, again, this area. The costs, you still pay your Medicare Part B premium. You still pay your $104.90. There may be additional costs on top of that. Sometimes there are not. They're all very, very different. Again, usually instead of a percentage copay, it's more like a dollar, like a $10 per office visit copay that you pay instead of a 20%. So that's just the way they work. You must live in the service area, so that's no big surprise. What question we get a lot is what happens if I'm on vacation in California and I'm insured here and Aetna or whatever doesn't work there. So you're allowed any emergency visit elsewhere outside of your network, you would always go back to original Medicare. So you would still get that paid for, but if you're seeking regular care outside your service area, Medicare is going to say, we're not paying for that. So you got to change it. Okay. Yes. Oh, yes. Sorry.
So if you decide to live overseas for a period of time?
Well, the overseas is different. So that's the Medicare system fundamentally does not work at all outside of the country or the territories.
Not even for reimbursement?
Not even for reimbursement. So if you get a bill from a doctor of from another country, I mean, if you have an emergency situation in which you need to get care and you're in Germany or whatever, they will likely consider payment. But if you're seeking regular care, Medicare fundamentally will not pay. So. Okay. Oh, sorry. Yes.
Yeah, I'm just a little bit confused about, is there a difference between MEDIGAP and Part C?
There is. Yep. So Medigap only works with original Medicare. So that works with Medicare A and B. So Medicare Part C, you're stepping outside of original Medicare, and you're stepping into Medicare Part C, in which you could not have a Medigap plan. So you're stepping out of original Medicare and going into a managed care environment. So again, here's just some dates to throw at you. Again, your initial enrollment period, we talked a lot about that 7-month window. Medicare's open enrollment period, so we're kind of in the winter now. We just came away from open enrollment, but this is every year for Medicare Part D, as in drug. So that's October 15th through December 7th. The reason that Medicare open enrollment is very important for Medicare Part D is if your drug needs change or your income changes or maybe the plan's changing the way they cover your prescriptions, October 15th through December 7th is the one time per year you're able to sort of look at your prescription plan and see if it's worth changing. So, and we do encourage people to do that. We offer counseling services through our office where we can go with you on the Medicare website. There's a thing called a plan finder that you basically would load up the prescriptions you're on, and it would look at the costs of all the plans in your area to see if there's a better choice for you. And it's just an opportunity every year to kind of reassess. Okay? All right. So again, the January 1st through February 14th, this is if you want to get out of a Medicare Part C plan, if you want to disenroll, it's basically January 1st through the 14th is the one time a year to do that. Yeah, the question is what happens if you start off with Medicare, original Medicare, and then in the middle, open enrollment, whatever, you say, why not go to Medicare Part C? You can do that, in which you would stop paying your Medicare supplemental plan because you couldn't be in a Medicare Part C and have a Medicare supplemental plan and then switch to whatever company you choose.
There is no penalty?
No, there's not a penalty to, but if you want to get back into your original Medicare with a Medicare supplement, you've left your medical underwriting or, yeah. It's not, I wouldn't think of it as a penalty. It's just that they're going to assess, they're going to be able to ask you questions about your medical history. So your rate's going to go up. It's just like your car insurance. You've had 4 car accidents. When you get rates from insurance company, they're going to say, well, you had 4 accidents. Your rate's going to be... It's not necessarily better, but it's probably the most cost-efficient way. Okay? All right. So Medicare Part D, the drug plan, we talked about that. So again, these plans are approved by Medicare. They're run by insurance companies like all the other insurance names that you've heard. They're available to anyone, everyone in the Medicare program. The average premium, this is a national average, the average premium is $33.13 per month to stay in one of these plans. So they often come with a deductible. Not all of them have the $320 deductible, but a lot of them do. And there may be co-insurance and co-payments for your drugs along the way. The donut hole, this is the sort of coverage gap that we talked about. We like to talk about, you haven't heard a lot of it lately, but basically it's about a $2,500 gap, anything north of about $3,500 worth of total drug costs that you are required originally to pay 100% of the cost for. Now, the donut hole is due to sort of close by 2020 and not have it at all. There will not be a coverage gap at all, hopefully. Right now, you're expected to pay 45%. It used to be 100%. Now it's 45% of the difference within that period for brand name drugs. And then if you're on generics, it's a little bit cheaper. And then if you go past $4,700 roughly of total drug costs, you are considered catastrophic and you virtually have no cost sharing. Okay? So to be eligible for requirements for Medicare Part D, to be eligible, you have to be in a prescription drug plan. You must have Medicare Part A and B. So you can't leave B on the shelf and just go with A and then take Medicare Part D. And you must live in the planned service area. Yes?
Yeah, why does it say and or A and B?
Well, some clients have actually do not have A, but they do have B. And that's a residency issue. So some clients we actually see do have, in other words, the state of Virginia may pay for their Medicare Part A other ways, and on their card it just says Part B. But for most folks, it's A. They're going to have A and B. So, okay? Okay, so the time to sort of get into these Part D plans is similar to your 7-month window for your Part B eligibility, that 7-month window. Your open enrollment every year is at October 15th through December 7th, and for a January 1st start date of that change, if you made a change. Again, January 1st through February 14th is your chance to leave a Medicare Advantage plan and go back into a original Medicare and a Medicare Part D plan. So, like Medicare Part B, there's also penalties in Part D for you to join late. It's a little different, it's not quite the same, but if you wait beyond your eligibility period, you will be given a 1% penalty on top of whatever rate they give you for every 1 month you went without Medicare Part D services coverage. So that's the same reasoning as that they don't want people to wait until, oh, I got just an expensive prescription from my doctor, now I want to get that Medicare Part D. So you have to wait for open enrollment and you may be given a penalty. Okay? So again, for what does it cover? So most drugs that are FDA approved. The plan finder that I talked about before, coming through us or doing it yourself at Medicare.gov, will show you the list of formularies each drug plan covers, which is so even though it may be an FDA approved drug, your particular brand of drug, there may be 5 other choices, and that one is not covered by that plan. So it's something you may want to consider and not picking that plan. So. Okay. So you'll gain access to covered drugs, obviously. Plans can manage this access in many different ways. Formularies, basically that's a long fancy word for just a list of drugs that are covered. That's the most common way. They could also require prior authorizations. They could also what they call step therapy. In other words, they're going to say, well, for the first 3 months you're going to be on a generic, and we're going to measure your outcomes, and then if you can prove that it's not working, you could, we'll give you the name that you want. They could also impose quantity limits. Yeah. So your rights under Medicare, again, you know, you have, you know, you have the protect the. When you want to get access to health care, I mean, that's fundamentally the spirit of the Medicare program. So it is ensured, you know, the program is there to ensure that you have medically necessary treatments. It protects you against unethical practices, protect your privacy, all that good stuff. There is a fraud component or anti-fraud component to Medicare. That's something we also deal with a lot in our office, where if you feel like there was some rights that were being violated in any way, if there was a privacy issue, if you're getting billed more times than you were there, or maybe the doctor visited, you know, you were there for a half hour, they billed for an hour. All these issues you could feel free to field through us, because it's part of our job is also to make sure the Medicare program is working sort of ethically and there's no one taking advantage of it. So. Okay, so we talked about complaints and sort of 5 levels of appeal, but you have, in any of this, you have always a right to file a complaint. You have a right to appeal any denied treatment, and that's any component of Medicare. You have the right for your personal information to be kept, so if you feel that's, you know, a problem, you really want to talk to your doctor's office about that and make sure that they are. But again, the 5 levels of appeal, and we can help you with that. They're there to sort of make sure that if you feel that there's some, you know, what we see the most of is if there's some other technology that just goes it may be new that Medicare just doesn't fundamentally recognize. It doesn't necessarily mean that it's not worth having. You know, it's still, you want it and your doctor agrees that you should have it, so go through the appeal process. A lot of the learning process through Medicare about new technologies comes out of the appeal process, because they say, well, this is a new technology, it's cutting edge, and we should maybe pay for it. So it's very important to keep in mind. So again, you can have right to file a complaint, grievance, you can go through us. So here's your Medicare summary notice. You're going to get a quarterly statement from Medicare if you're not going through the Medicare online. You can create an account online like any other account you have, like a bank, and read all your Medicare activity as it's live. But if you don't do that, they'll send you a Medicare summary notice, which is a statement, like a quarterly statement, that lists all the activities. So that's kind of your evidence, so to speak. So keep that in mind, and then keep copies of anything you appeal, of course, as you go along the way. So here, what we'd also like to talk about are programs for folks that some of the numbers I threw around at you, the Medicare Part D premium, $33, may be, difficult for them. There are programs for folks with limited resources. The most popular one, I would say, and we deal with this all day, is a program called Extra Help through Medicare Part D, in which if you're making less than roughly $1,400 a month, and if you're single, it would largely subsidize your Medicare prescription, so you would not have that $33 month fee, and you would have virtually like no your copays would be like $2 or $3 for your drugs. Okay, so how do you know if you're qualified for Extra Help? It's actually run through Social Security. So we tell folks, if you think you're close or whatnot, just apply. You can go through us, you can do it through Social Security, but there's only one way to find out, and that's to just apply. Okay. Medicaid, so that's another component of what we do. This is a federally and state-funded program. It's run by the state of Virginia, but it also helps with Medicare, so what Medicare doesn't cover, or some of the costs within Medicare, so consider that. Other sort of Medicare savings programs under Medicaid may help you with the Medicare Part B premium, which is very significant. Also with the Medicare Part D costs. So there you go. VICAP counselor, that's our direct number. You can call the 800 number on the SLIM card or call us directly.